So here we go. So our battlefield are our little innocent molars and premolars, canines and incisors. So our full mouth of teeth, that's what we're battling for. We try to keep these as long as we can. We've got to keep them for hopefully a good 70 or 80 years once we get all of our dentition when we're about 12 years old. So, you know, this is what we're fighting for. And the most susceptible areas of the teeth are your pits, fissures, deep grooves, and then especially as we get a little older and we have some recession, are the root surfaces of the teeth. Next slide. And as you can see from the picture here, might be a little, we'll turn off the light just so you can see a little better. Sometimes the screens aren't great. You can see the tooth here. There's some really deep grooves in here. You can see the staining in there. That doesn't always indicate that there's decay going on in the tooth, but it's suspicious, and it's very microscopic areas that little tiny bacteria like to get into and attack. In addition, between the teeth, small areas are where the bacteria like to go. So those are our most susceptible areas. And so our scaries, we call them scaries. Oh, go ahead.
What's a fissure?
It's where when the tooth forms and the little buds come together, they create just a little valley. And so that's a little fissure between where the tooth is grown together. Good question. Dental decay for us in the field is called caries. So these are our scaries. It's caused by bacteria. We say our mutant bacteria is Streptococcus mutans. That is the most causative bacteria for dental caries. It's most commonly transferred from mothers to their children. And that doesn't mean other family members can't share it, but sharing straws, giving kisses, you know, if mom doesn't keep her mouth clean, in addition to the rest of the family, dads too, brothers, sisters, just like any other infection, it can spread. Also, we have lactobacillus is another pathogen that we look out for, and this is dental caries are the #1 disease among children. So above colds, flus, anything, it's the #1 disease and the most common reason why children miss school. So, we'll go to the next one. Our weapons of mouth destruction are cariogenic products such as sugars, like candies and juices, gummy bears, and then cooked starches, any sort of carbohydrates, potatoes, potato chips, anything you can think of, fruits, can all be used by the bacteria. One of the other things is a number of troops. You're always going to have these bacteria in your mouth. It's almost inevitable that these causative agents are going to be transferred from one person to the next. But the main thing is how much of the bacteria is in there, and that's why we stress daily flossing, brushing twice a day, because if you keep the numbers down low enough, you can usually keep everything in check, and you may further prevent dental decay, but not always, but you do what you can. The bacteria have a military base. We call it Denzil Biofilm, otherwise known as plaque. And this is a matrix that, as you feel every morning, it grows on your teeth, and it's a protective area for the bacteria. Your body can't fight within that military base for the bacteria, so they're in there attacking your teeth, and your body really can't do a whole lot about it. So all you can really do is what you do at home, so brushing, flossing, those are your main weapons. And then their weapons are an acid attack, so it's made from the carbohydrates that you consume. They eat it, and just like we tell the kids, they eat the food and they've got to poop somewhere. So where are they going to do it? They're going to do it on your teeth, and it's going to break your teeth down. So, you know, you don't want poop on your teeth, so you've got to get it off every single day. And when people say you have bad breath, well, now you know why. It's waste products. So here's a little illustration on demineralization. So the bacteria are in this biofilm here. You eat the sugars, they go into here, the bacteria eat the sugars, and then they poop out the acid. Some of it goes out here into the mouth that gets neutralized, but the stuff that's stuck right to the tooth, it's going to start breaking down the tooth. It takes the calcium out of the tooth structure, and it starts breaking it down. So what are our defenses? Unfortunately, the targets are the same as our defenses. The tooth has 3 different layers that the bacteria like to go after. The enamel is the outermost layer. That's the nice pearly white. that we see. It's very hard. It's the whitest layer of the tooth, but it's our best protection. Underneath we have the dentin, which is softer. It's the middle layer. It's kind of yellowish. This is what you see on the root surfaces. If you have any recession and part of your tooth looks different, doesn't look as white as the top part, the root is mainly composed of dentin, and that's what you see, but that is also underneath the enamel. And then we have the pulp, which is the nerve and the blood supply of the tooth. And this is what the bacteria is going for. That's what they're looking for. So hopefully this little illustration, you can see this outer white part is the enamel. This part underneath is the dentin. As you can see, here's the root structure here. When you get a little recession, you're just going to only have that dentin there, and it's not a very good protector against the bacteria and their attack. And then there's a nerve tissue underneath, and you can see as the decay stays there longer, it spreads further along. Once it gets to the dentin layer, there really isn't much you can do except to get a filling, unless have a dentist treat it. So, you're very limited once it gets past that outermost protective layer. All right, so shock and awe. What happens? I said the demineralization, the enamel matrix is compromised by allowing bacteria in, and when it advances to the dentin, it's kind of game over. We need to do something. However, if it stays in that enamel, there are things that we can do, which John will talk about, in order to prevent getting any decay. The consistency of the karyogenic products. So your chewy or sticky, your gummy bears, candies, any foods that like to stick around and get into those little pits and fissures are going to have a longer attack span. And any foods can, these chewy or sticky foods can cause an acid attack up to 40 minutes. And this leads into the frequency. So each introduction starts that time clock over. So you take a sip of soda, okay, there's about 20 minutes of an attack. 5 minutes later, you take another sip, okay, let's start that clock over. So it goes one after the other, it just keeps going. So you consistently have an acid attack on your teeth if you keep sipping. So one of the big things that we tell adults and mostly kids, if you're gonna have candy or have sugars, have it with a meal. If you're going to have a soda, just drink it all at the meal and then have water in between. Same with juices. Don't put the baby to bed with juice. That's the big no-no. It's just constant sugar bath on the teeth. But that's the same thing with adults. I'm sure we all like to, have a bag of candy sitting around, or you're at the office. You say, oh, okay, well, there's a cake right there, so I'm just going to grab a little slice. Okay. An hour later, okay, I'm going to grab a little bit more. So you're just constantly attacking the teeth. So those three things, are really what, it scares our teeth, and then that's the big attack. All right. And so, is there anything that we're going to stop this madness? Holy humanity! So I'm going to pass it over to Jonna, and she will address this issue.
Okay, thank you. So our first way to attack the decay are sealants, super sealants. So what are sealants? For those of you that may not have sealants or may not have children that maybe have sealants, sealants are a thin plastic coating that's usually placed on the chewing surfaces of back teeth and sometimes premolars. The sealants fill the grooves and they keep out the cavity-causing germs and food that Jimmy just talked about. So getting sealants put on is a simple and painless procedure that can be done by a dentist or a dental hygienist. And it's a pretty quick procedure that I'm going to go through next, so it's nothing to be scared of. Millions of children get sealants every day. So how are sealants put on? So first, the tooth that's going to be sealed is cleaned off very well. The tooth is dried and cotton rolls are put around it because isolation is very important when we're putting sealants on teeth. A cleaning solution, which is an etch, is placed on the tooth, and that for about 20 seconds. And this not only helps clean the tooth, but it also roughens the surface a little to add retention for the sealant that's going to be placed. Then that cleaning solution is washed off, and the sealant is applied in a liquid form, usually in a thin, even layer that's spread out into all those pits and fissures on the tooth surface, and then it's hardened. We have curing lights that take the liquid to a hardened material, and then of course we always check it for retention. So that's just a quick rundown of a sealant. This is a before and after picture of a lower molar that has had a sealant put on it, and as you can see, the tooth didn't have any staining or any caries before the sealant was put on. It was put on for preventive means to protect that tooth from any future decay because of the depth of those pits and fissures on the tooth. So children should get sealants put on their permanent molars as soon as they come in. So before decay even has a chance to start on those teeth, we want to get the sealant on as soon as possible. So first permanent molars usually come in between the ages of 5 and 7, and the second permanent molars are usually between 11 and 14, depending on the child. It's all different. Teenagers and young adults prone to decay may also need sealants. I mean, sealants can be for anyone. I just had my sealants redone last year, I think. So if you have the deep pits and fissures, or if you have somebody prone to decay, sealants can be put on anyone. So often parents ask, should sealants be put on baby teeth? So this is, a dentist may recommend putting sealants on baby teeth if there are deep pits and grooves in those teeth as well, just because it's very important to keep baby teeth as long as possible. They're holding the space for the permanent teeth that are going to come in later. So we want to make sure that we keep those teeth as long as possible so that we don't have space issues later on. Yeah.
I had a question. How long does sealant last? Because you just mentioned you've had yours redone, so.
Right. It's very dependent. They should always be checked at every yearly exam. The dentist should check the sealants because sometimes little pieces may chip off and they may need to be redone. Usually, if you have a sealant done when you're 6 on your first permanent molar, it's not going to last your whole life. So they often have to be redone if it's indicated. So in addition to sealants, fluoride is another important way to prevent tooth decay. So fluoride, the two most common forms of fluoride we're going to find are fluoride that's in our toothpaste and in our mouth rinses, and then also in fluoridated water. So about 2/3 of U.S. cities have fluoridated water. And then also, if the water isn't fluoridated in a community or area where you are and a child needs additional supplemental fluoride, there are different ways that we can prescribe it in drops, tablets, gels, and mouth rinses that we can get that supplemental fluoride to anyone that may need it. So fluoride is going to make the teeth more resistant to decay. It repairs tiny areas of decay before they become bigger cavities. So if we are doing routine radiographs and we see a small lesion that, like Jimmy was explaining earlier, may not be into that dentin yet, it's still just in the enamel, we may choose just to watch that tooth and try to reverse that decay process by maybe increasing the amount of fluoride or putting some fluoride varnish in the area to try to stop the spread of that decay. We may not need to treat it right away. So it also makes germs in the mouth less able to cause decay. So you may often see some fluoride varnish if you go to the dentist, or they may say, can we put fluoride varnish on your children's teeth? So fluoride varnish is a sticky paint that provides short-term prevention on smooth surfaces that are at risk for decay. So sometimes fluoride varnish can be applied 2 to 3 times a year. It's a great way to put it on children's teeth, or put it on the root surface caries that Jimmy was talking about. Sometimes we put a little fluoride varnish on those areas on our adult patients. But it's important to note that the fluoride varnish is most effective on smooth surfaces of the teeth, and it's not as effective on the chewing surfaces of the teeth where the pits and the grooves are. But the most effective way to prevent any decay is a combination of sealide and appropriate fluoride use, and that's going to be your best defense against decay. That's everything, yeah.
Well, as far as just, oh, go ahead.
Okay, so let's say that you have a tooth that has very deep pits and fissures and it's stained. How are you going to differentiate between sealing that tooth and filling that tooth?
Well, there are a number of ways as far as checking clinically, radiographically, if there's anything suspicious. If we get you've probably gone through the dentist, you usually go through the Explorer, get a stick, okay, we need to do a filling, and if it feels nice and smooth, usually just keep it as is. Like Judy said, there's some times where everything looks suspicious, but you may not have something that just indicates that you need to put a filling in there. So there are a number of ways to go about it. You can open up the fissures with a little burr, so you're not taking much tooth structure, you're staying in the enamel. And that way you're keeping that outer protective layer of the tooth intact, but you're getting that stain out just in case there is a little bit of decay in that area. You can also use an air polisher, which uses a little, it's almost like a sandblaster. And it can sandblast that stain out. If that doesn't get it out, that does indicate that there's probably something else going on, and that you need to open up the tooth a little bit more, whether you need to open up the grooves and get that stain out, or whether you actually do need to put a full-on filling into that tooth. So there are a few ways that you can check and determine, what that area is doing. If it's in an older patient and you have been following them regularly and there's nothing wrong, they don't have a history of having a lot of cavities, it may just be an area of maintenance and one that you just keep on watch. Say, you may not need to be as aggressive in your treatment because that area is being maintained. Same thing as John said, if there's an area between the teeth that looks suspicious, well, if they're 13, okay, well, they haven't had that tooth that long for something to develop. If they're 60, well, they've maintained that probably for several decades. And so keep it on watch, and if there really is no change, it's probably an area that there was some demineralization, maybe when they were younger and didn't take care of their teeth, but it remineralized, and it's just an area of maintenance now for that particular patient. It's all individualized. You never think, okay, well, I just saw that on the patient right before the hour earlier, so it's the same thing with this person. You have to take everything into account. Have they had a lot of fillings? Have they had them recently? Do they have a mouthful of decay right now? Do we need to be a little more proactive in our treatment? So.
Question, you said if you open that groove up, do you restore that or do you seal it? What do you do with it?
If we do any sort of maintenance or any sort of...
Yeah, so a lot of times we call them a preventive resin restoration, or it can just be a sealant that you go in with that fissurotomy burr and open it up a little, and it's a very small burr. And so depending if it stays that small, yeah, you can just go ahead and put the sealant material right in it, or sometimes flowable material can be used depending on the size that we open up that fissurotomy to.
Since this is a type of preventive care, on our health insurance, on our dental insurance, if you have our dental insurance, we pay for sealants for 16 and under for children at 100%. So just as an FYI, if you have children, I both. I think so, but we do pay for those at 100% with no deductible.
So a lot of our preventive measures, are aimed at everybody, but they're aimed at children. We want to get them a healthy mouth when they're young and they're not able to take care of their teeth. So you think, kind of the general rule of thumb, until your child can write cursive, they don't have the dexterity to fully take care of their mouth. So as they're younger, of course, okay, let them brush, and then knowing that they probably didn't do a great job at 4 or 5 years old, you're going to go back in there and brush for them. As they get a little bit older, they get maybe more checking. You brush a little bit here and there, and you're teaching them ways to really reach those areas, and really teach them how to floss as they start getting more dexterity where they can actually manipulate the floss. Anything that we do in the office, when you get anything done, whether it's child or an adult, we're basically getting you to a clean slate so that you can take care of it at home. Whatever we do, all the bacteria that we scale off, that we remove when we do a filling, all of that's going to start to grow back within 12 to 24 hours once you leave the dental chair. So it's really, all right, you're coming in, we're checking everything. If you're doing a great job, we just, clean up where we can, fix little spots here and there, but it's basically getting into that starting point to take care of it between visits. Everything is really reliant on the individual to maintain throughout their recall visits. So you think 6 months in between, it's only what you do. We're not there to floss and brush and tell you to rinse and not, drink sodas between meals. It's going to happen, but it's up to the individual to take care of their mouths. As children, it's like, okay, well, let's do what we can to prevent, things that they have no control of. When they're so young, they're not going to be able to take care of their teeth. They're going to rely on the adults in their lives to take them in, and then also, consider what they're doing on a daily basis to maintain their oral health. Go. Go ahead.
This is a little bit related, I think, but do those teeth whiteners or most of those products, do those make you more prone, do they drug the enamel to make you more prone to get cavities?
Initially, right after you've used any of the whitening products, there are a couple of some people say you do and some people say you don't. The research isn't completely sure which way or the other. It does dry out the teeth, so I think in essence you would think that teeth are going to be more vulnerable to any sort of attack. So if you're going to whiten your teeth, I would recommend that you use some fluoridated toothpaste. Make sure you're not eating a lot of foods that are going to cause a lot of acid attack. And soda's included. Soda is an acid, so even though you're drinking diet soda, it's an acid. So kind of think about that as well. So I would just be more cautious. If you're going to use a product, I'd be more cautious in the time period after while you're using it.
Sometimes you can fill the tray, the weighing tray with some fluoride gel and put it in, after you're done weighing or before you're weighing to help, strengthen these surfaces. This is what I do just because I'm paranoid about it, because the research is, I know it dehydrates the tooth, so I just try to take precautions.
You had another question?
What's the youngest age that you would recommend a child come in for a sealant?
Go ahead.
That's probably going to depend whether or not they are going to, if they recommend having sealants put on the primary teeth, the primary molars. So, by age 3, children usually have all of their primary teeth. So, and then that's going to be kind of up to the dentist to see if, they're more at risk, if they have the deep pits and fissures, if they need to do the sealants on the primary teeth. But if it's not indicated in the primary dentition, then as soon as those first molars, those 6-year molars, which can come in anywhere between 5 and 7, as soon as those first ones come in all the way, that's when you want to get in and get the sealants on them right away.
Yes.
So, what have you read in the literature regarding whether or not you should put sealants on children who are, if the tooth has been in the mouth, say, more than 3 or 4 years, and they don't have any restorative, should they have sealants or not? So you have 9-year-olds who's never had any cavities. Should we put sealants on first molars or not? And should ATSU pay for this? That's really the question I'm getting. What's the cost benefit here? I know they're gonna pay for them, but I want
I
to
don't
know
know what
what.
the research is, but I'm seeing kids in the junior high, and they are getting cavities in the underserved areas. They're getting cavities everywhere, in the strangest places, not necessarily in the group, but up on a cusp. And it's like, how did you get a cavity there? So they're decaying everywhere, because at 7th grade, I find like the OHI has just fallen off. 2nd graders have better brushing than 7th grade, so even though their tooth, I would say seal it, just from experience, and then seeing it break down at 7th grade is just a mess.
I would say, again, everything is individualized, so you have to look at the home care of the 9-year-old, but also if you're seeing that family, if they have older brothers and sisters, kind of see what their habits are. If you notice, like what Beth said, if something changes when they get older and they stop taking care of their mouth, well, maybe you'd be a little more preventive because you have seen that family. But if you're only seeing that 9-year-old, and that's the only basis you have to go on. If it's not indicated, then no, because any sort of restoration is going to create a margin. Whether, even the nicest sealant is going to create a margin where you can get bacteria will want to creep underneath that margin. So it really depends on if it really might not be indicated in that particular child's
So you're saying a
case.
bad sealant, incorrectly done sealant.
Well, even a good sealant is going to have a margin. Even the best restoration will have a margin. So.
Right, I'm trying to have an academic discussion with you on that. No, this is an important point because what I'm trying to get to is that parents think that, oh, we're going to put a sealant on and then it's magic, you'll never get a cavity. I never have to bring you back again ever. And that's part of the issue and then there are people who just go out and say like everyone needs sealant, so they'll see adult patients who have never had cavity. So it's unlikely that strep mutans is their primary bacteria, and so it's unlikely they will really benefit from the sealant. So you might put on a sealant that could not be a benefit. So I'm saying from a public health measure, while I'm cool with, kids who are under 15, because as you say, they sometimes develop bad habits later, while the bacteria doesn't change, they probably might stop brushing their teeth, and doing other hygiene activities. So, I can understand that, but adults who don't have caries, I mean, when you look at it, it's like, well, would they really benefit? And I do. I see adult patients who come in, and they're like, oh, I just had all these sealants done. And I'm thinking, why? Because their insurance didn't pay for them either. And there's a reason that the insurance companies, because when you look at the public health data, it really only pans out for kids, right? So for adults, it's not really a service. And so you have to be, it makes me a little leery of some of our colleagues what are they selling to patients when patients come in. And so it's important to tell patients who will benefit and who doesn't benefit from this. Because an adult who doesn't have a high caries index, right? I don't think we have to do the camera to see, okay, probably strep mutans is not their primary bacteria. They're probably not going to get anything out of that. So is it really, are you helping or harming them? It doesn't do any good at all. Should we just teach them to brush and floss? That's kind of where I'm going, because I think that I see adults all the time. They come in and they're like, oh, I just got new sealants. And I'm thinking, why? I mean, it's okay if you had them before, because you might have deep grooves. They might have done physiotomies, and now you might need them, right? Right. Because they took old ones off. I'm not saying that. I'm saying patients who never had sealants, who are adults, who suddenly think they need sealants.
I saw it on Dr. Oz.
Oh, was it on Dr. Oz?
Yes.
What did Dr. Oz say? I'm going to have to go look at YouTube.
But whatever he says goes.
No, yeah, I'm not discounting Dr. Oz.
The acid just in coffee, if you just drink black coffee, is that such a decayer? It's a stainer, but is it a decayer as well?
You don't have any sugar in it.
Okay.
You should be okay.
Thank you. Yeah, I know. It's pretty good. That's true.
Any sort of outside, if you're having it, it's kind of, if you can have candy, you're going to have candy. That's, I can't help myself sometimes either. You can try and buffer it like a piece of cheese after you eat a meal or after you eat dessert. That's going to buffer some of the acid, not all of it. Once it gets going, the bacteria in that biofilm is going to do what it does. But the rest of the acid in your mouth, you can buffer that somewhat with products like cheese, dairy products that will help neutralize some of that acid. So at least you can kind of lower that attack.
Or you want to talk a little bit about xylitol?
There's a product, xylitol, that's in Trident gum. You can also buy it on its own, where xylitol is made product. It does help neutralize the acid and changes the bacteria, I believe, so that they're not able to use the acid or use the sugars as well to create the acid. It is a useful product. One of the drawbacks is that you've got to chew it consistently, so I think it's a piece, like 5 or 6 pieces a day. It's very helpful as far as for new mothers, if you can keep up with it and put it on the agenda as far as, every 3 hours having another piece of gum. You can help lower the strep mutans in your mouth so that you don't spread it to your children. Go ahead.
Are there any side effects to that?
I am unsure.
Yeah, there's some reports in the literature of xylitol causing GI distress.
Oh, no.
Yeah.
So it can make you visit the bathroom more often than you may like. So you have to be careful on telling patients or letting them know that, because some patients really have that reaction. Especially if you're using it like little kid populations. And have to let them know. It doesn't affect everybody like that, but there are reports in the literature that. It's like eating too many xylitol gummy bears. It was really from Guam. They did a big study in Guam, and that's how they gave up the xylitol was in the gummy bears. So they might have been eating more than most people would. They thought, how can we get kids to eat xylitol 6 times a day? And so they put it in gummy bears. And that was the I guess the initial study. I don't know what the IRB thought about that in Guam, but I don't know if there was one. I don't know who was running the study, but there's one in Guam and there's one in the Marshall Islands on this stuff.
Thank you.
Thank you.